Welcome to On the Beat, everyone. I'm Troy Thompson, and today we'll be talking all about digestive problems and acid reflux with the man we've come to know to give us great advice when it comes to our health and natural remedies, the man himself, Mr. Robert White of Robert's Apothecary here in Columbus. Welcome to the show, my friend. How are you?
Thank you. Good to be here.
All right. Before we get into what are some natural remedies that we can utilise, what is acid reflux to begin with? Because is that the same as heartburn?
Another name for heartburn.
It is?
It is.
What is the feeling that one gets? Because sometimes I think I have it, but...
Burning in the chest area, up and down the esophagus.
All right. Now, what is it a prescription-based product that you could use? I know we're going to be talking about natural remedies. Is it something that we get something from the doctors if it's severe? If
it's severe, doctors will prescribe things like Prilosec, Nexium, Prevacid, and they greatly reduce the acid production in the stomach,
right,
which will then decrease that acid reflux.
How does one get acid reflux? Is it just eating badly, or?
It many times is from poor food choices, eating foods that are too acidic or too difficult to digest in the beginning. And when we have too much acid going on, then that causes acid reflux.
Okay, all right. So it's not a hereditary thing. It's just mainly because of what you're eating.
Most of the time.
Yeah. Okay.
That can be a genetic component.
Really? All right. Well, I want to talk a little bit about natural remedies, because you know we talk about this a lot, and I like that on the table. Do you know what I mean?
Sure.
So what are some natural remedies that one can do?
Probiotics, number one.
Is that a daily?
That's a daily thing.
Okay.
Digestive enzymes also. Probiotics are the good bacteria that we all have to have in our stomach and throughout our intestinal tract.
Before we go any further, I want to ask you, how do we know we have the right probiotic and if we actually need them?
Good question. The vast majority do need probiotics, particularly this time of year with infectious disease going on.
Right.
Because they help to keep our immune system up and fight off bad bacteria and viruses.
Robert, when I go to Whole Foods and places like that when I'm back home, there's so much to choose from. I don't know what to buy.
Exactly.
There's ones you keep in the fridge. There's some a normal pill. I'm so confused.
Exactly. It's wise to seek out someone in that establishment that may have knowledge about the differences in the probiotics.
Is that someone called Robert?
Robert is an excellent example.
Okay, what's the difference between digestive enzymes and probiotics?
Digestive enzymes are enzymes that we all produce, and they help to digest. For example, gallbladder, pancreas are going to be producing digestive enzymes. Probiotics are bacteria. They're the friendly bacteria. And we consume those instead of producing those.
Right. Okay. Well, here's a question I wrote down the other day. Is there a difference between probiotic and prebiotic?
Excellent question.
Because I've seen the difference, but I don't know what I'm doing.
Prebiotics are not bacteria, unlike probiotics. Prebiotics are the undigestible fiber that prebiotics feed on. So we have to have prebiotics in our gut for the good bacteria to flourish. And you get that in fiber in foods.
Yep.
And we also have prebiotics that can be taken in conjunction in a capsule form with the probiotics.
We know we can come to someone like you, okay, for information on probiotics. It's good to go online and have a look.
Good to go online because there's such wide variations in formulas.
Got you.
And the grocery store is usually not going to have somebody knowledgeable.
I appreciate you as always, buddy.
A pleasure.
Thank you so much. If you want to find out more, there it all is up on the screen for you. Give them a call, Mr. Robert White from Robert's Apothecary. Back after this short break.